Hi, my name is Jon Harol, and I'm the president of Lighthouse Lab Services. There's a lot of laboratories that started testing during COVID that are doing PCR testing, and they're looking for new lines of testing that they can move into. One of those spaces is podiatry, using nail fungal testing, which is a PCR-based test that can be done on the same equipment that was used for a lot of COVID testing. We have customers that we're in the process of pivoting into that podiatry market now. There's a couple big players in that space, but there's a lot of green space too for others to join it. Reimbursement is strong, and the equipment, the know-how is already in your lab. You're already certified to be able to do the work. So I think that's a no-brainer for groups that feel like they could maybe capture some of the podiatry market. As we enter the endemic, we're working with our COVID clients to find new lines of testing that they can enter into. One of those is doing UTI testing. You're able to do that testing on the same equipment, using the same staff under the same CLIA certificate. And the UTI test through PCR is just such a better test than what's traditionally been done. Typically, urinary tract infections have been tested through culture and sensitivity, which includes incubation period of days. And so physicians are trying to do their best to guess at what type of antibiotics are needed in the meantime while they wait for the results of that culture and sensitivity test. By using PCR testing, you can result out in hours, less than a day, and we can also provide guidance on what type of antibiotics the physician should use. So I think it's just a better test that's replacing really old science. A lot of customers, clients come to us and they're nervous about the shift that everyone's talking about from healthcare going from a fee-for-service model to a value-based care model. I think that's going to happen. It's inevitable. I don't think it's bad news for the laboratory. The laboratory provides the data that's needed to make medical lab decisions, and healthcare can't be provided without it. If anything, that laboratories have been undercompensated for the role that they play in healthcare. So as we go through that shift, I think the shift in payment is not going to be felt by the laboratories directly, but indirectly. So commercial payers may compensate physicians, groups, health, ACOs, health systems for treatment of a patient in a value-based care model. I think the laboratory testing itself will still be done on a fee-for-service arrangement. There may be some risk sharing, a pool that both the physician and the laboratory are jointly part of, but the actual testing, I think, will still be reimbursed on a fee-for-service basis. Labs that are under that model need to know that what's going to be important is how cost-effectively can you run laboratory testing. Courier services, turnaround time are going to become really important to physicians as they have to pick what laboratory is doing their testing, and they feel the pain of whether that was done well or not. Most common question we're being asked right now is, what do I do coming out of COVID? I built a COVID lab, or I have a laboratory that's done a lot of COVID testing. What's next? That post-COVID pivot is going to be challenging. There's a lot of strategy and thought involved in that. I'm going to be doing a session at the Executive War College just on this topic. So if you're there, would love to see you at that session. We're going to go into what can you do as a laboratory to come out of that COVID pandemic strong, take what you learned and apply it, but also move into new lines of testing.